I'm Dr. Kimberlee Wyche-Etheridge, and I'm ASTHO's Senior VP for Health Equity Initiatives here at ASTHO. And I'd like to welcome you to our conversation, our continuing series of messages really devoted to highlighting diversity, equity, and inclusion, both within ASTHO and as it reflects in our work with our state and territorial health agencies and other partners. As you know, April is National Minority Health Month, and this year's theme is Give Your Community a Boost. And it focuses on the continued importance of COVID-19 vaccination and boosters as one of the strongest tools that we continue to have to protect our communities from COVID-19, which has unfortunately disproportionately affected communities of color. Today, we have the pleasure and really the honor of speaking with Paula Tran. And Paula is the state health official and the Division of Public Health Administrator from the Wisconsin Department of Health Services. And in her role, she has played a key part in the COVID response in her state. And so first, Paula, thank you so much for joining us today.
Thank you so much for having me, Dr. Kim.
It is truly a pleasure to hear from our members and hear from the people really on the front line in this COVID response. So it's April. It's been 2 years or so in this battle. And as we continue with our kind of COVID battle fatigue and all, tell us a little bit about how your state is doing with COVID now.
As other places across the nation are seeing a slight uptick after a really welcomed downward slope from Omicron. So over the past month, we have seen a slight uptick in cases. And a part of that is, we have transmissible variants, so it's not entirely unexpected, as well as more folks interacting in the world, more folks traveling, spring break time, things getting warmer. So we are unfortunately seeing an uptick, and we know that at this point in the pandemic, we have more tools than we ever did. So we continue to, in the spirit of Minority Health Month and the theme, to encourage folks to get their vaccinations for COVID as well as their boosters. And that continues to be a strong focal point of our messaging, to test when they are symptomatic, to test when they believe they've been exposed, to stay home when they are sick, and to wear masks whenever that makes sense for their own risk factors as well as the folks that they might be engaging with.
How is your state doing with the vaccine and the booster? It's been so much conversation about back and forth about get vaccinated, get your first booster, get your second booster. Do I need a third booster? How is your state doing with the numbers?
We certainly want our numbers as high as possible. Right now, we're about 64% of Wisconsinites that have received their first dose, about 61% of Wisconsinites that have completed their series, and about 33% that have received boosters. So we're really encouraging Wisconsinites to get out to get boosted, and we're doing everything we can to make sure that should folks choose to be boosted, that they have every opportunity to do so.
And what would you say has been most successful in getting into some of those most vulnerable populations and encouraging and being successful at increasing the vaccine rates and numbers?
Yeah, we know that we are not always the trusted messengers. So we've really invested in community-based organizations all over our state. Every county has received dollars, and community-based organizations in every county in our state have received dollars to really get the word out there, to help answer questions, alleviate concerns for anyone that does have questions and want to get boosted. So we've seen, we've really tried our best to invest in boots on the ground efforts to get the word out there and really help folks get appointments and get in to get their boosters. And we're seeing, in a state that sometimes is very embattled with racial inequities, we're seeing a nice distribution across communities of color in Wisconsin getting vaccinated. In fact, some of our tribal communities were on the leading edge in getting their tribal members vaccinated. So we're really proud of the work that has been happening, and certainly continue to want to make sure every individual in our state, and in particular communities of color, know that the vaccines are safe and that they are available to them, and want to get every question that they have answered.
So it sounds like having, as you said, the boots on the ground, or finding those trusted members in the community to be able to give the message and encourage populations to, whether it's get a vaccine, get tested, get boosted, or whichever is needed at that point.
Absolutely. And that, in addition to investments in our communications and boosting campaigns, and working with key partners around the state as well, such as the American Academy of Pediatrics, and really engaging our healthcare partners across the state and our local and tribal health departments as partners on the ground as well.
Well, you mentioned communication and the importance of communication. How has your state been handling the issue of misinformation, and getting those facts and those truths to, especially some of those communities that are most at risk?
Yeah, so we have been investing in creating tailored campaigns for various communities. So have been working with communications experts all across the state to really understand how best to make sure we are sharing information in ways that are culturally relevant, and responding to folks whenever possible in their first languages, and making sure resources are available through social media and our websites, and getting as much information out there as possible. Whenever we can, we segment our information and really try to prioritize channeling the right messages to the right communities, so that we're making sure we're responding to folks' questions in the most culturally responsive manner.
And we know that some of the best tools, as you were mentioned, with communication and even technology, has really helped with the COVID response. This has been an opportunity for people, or for organizations around the country, to kind of rethink how they've been doing health equity, and to have it better ingrained or incorporated into the whole department. What has been your health equity strategy to increase it across the department, and not just in response to COVID?
As we think about health equity broadly, we are really trying to embed equity strategies internally as a department, to think through what capacities we need to build within our staff and within our systems and structures. So both embedding across the workforce, so that everyone knows that they play a role in advancing health equity, as well as hiring staff where it is their explicit role to advance health equity. So we've got a nice balance of offering individual staff ways to think about goals in their own work, as well as staff that are thinking about some of those equity strategies in a more cross-cutting fashion. And then as we think about some of our portfolio of work, wherever possible, we're embracing more upstream approaches, and really thinking about embracing the work that we've always done with some root cause thinking, so that we can have a more balanced approach when it comes to thinking about those root determinants of health.
Can you think of, in that light, a success story that you're most proud of when it comes to health equity in your department?
Yeah, that's a great question. One success is, I've been working with the department, or as a partner to the department, for over 10 years. And, 10, 12 years ago, it was really hard to understand who was doing equity work, which part of the programs that was happening. And now, over a decade later, we have 8 of our bureaus and offices are all striving to embed equity in their work. And we have health equity strategists embedded in the majority of our bureaus and offices, as well as at the administrator's office level. And we've lifted up some of our most historical minority health programs, from programs all the way up to the department level. So I think we've made some really great strides at making sure our structure and org charts reflect our commitment to health equity, by naming key offices and key staff to those roles.
So it sounds like it's a complete departmental I'm going to say ingraining of health equity, and having been successful with that many of your departments is a testament to your leadership and commitment to to health equity. So you have a lot to be able to share. If you could think of a couple of things that you would say that other shows or our territorial folk might be able to learn from you, from your experiences, from your lessons learned, what stories would you highlight to tell them?
Yeah, as many health departments are doing across the nation, are doing our best to really increase the diversity of our workforce while also making sure our workforce feels included and celebrated and enriched. So I think there is a huge opportunity around workforce, especially after what we've all experienced over the last 2 years. And I think in particular, as we think about COVID-19 response and transition into management and begin sort of preparing for the cycles of surges and coming out of surges, to really connect our investments now related to COVID to a long-term trajectory of recovery that really centers equity and really rebuilds and strengthens our public health infrastructure. So I think we're doing a lot of work to align and connect dots to not have COVID recovery conversations that are separate from longstanding public health infrastructure challenges that we have. And we're really looking forward to some of the federal investments coming down and really thinking about how we leverage those investments in our workforce and public health infrastructure, as well as continue to explore sustainable funding to make sure that we can maintain some of those changes as we move forward.
Well, Paula, thank you so much for taking the time to share with us, and thank you for the work that you have been doing on behalf of the we'll say underrepresented or under-resourced populations in your state. And just being part of the ASTHO family, being able to send some of those lessons learned to others, that they may actually, either the best form of flattery is repeating something, so that they may be able to do some of the good work that you've done and really move health equity forward. Appreciate you.
Thank you so much, Dr. Kim. It's really a privilege as a Wisconsinite my entire life. I've been so humbled to be able to work on behalf of the residents in our state, and it's been a privilege to really lift up the voices of those that have been most impacted by inequity, and to work alongside of really committed public health workers that want to see change in our state.